Hi, I'm Martin Kelsall. I'm Director of Primary Care Services here at the NHS Business Services Authority. We provide an eclectic range of services to NHS organisations, NHS contractors and the general public. We carry out an amazing range of services which accrue to £48 billion worth of funding each year. These services can be split into 4 categories: our citizen services, our workforce services, primary care services and our data and insight team. Within primary care services, we are responsible for processing prescriptions and NHS dental activity. We process over 1 billion prescriptions items each year dispensed in England, and we process over 43 million dental claims. We also offer support to our colleagues on the front line, pharmacists, GPs, optometrists and dentists. We create a suite of reports that enable ICBs to track trends and make informed decisions. We also have a modern high-tech scanning suite that saves NHS organisations vital space and money.
We process over 1.1 billion prescription items annually, with over £12 billion reimbursed on prescription drugs in primary care. We produce a range of materials that are invaluable to pharmacy staff, including the drug tariff that dictates the fees pharmacy contractors will be reimbursed when delivering NHS services and dispensing drugs.
We also manage the DM&D, which is a dictionary of medicines and devices in use across the NHS, and their descriptions and codes. It's refreshed on a weekly basis and contains a huge amount of information. The DM&D is important for the effective functioning of the electronic prescription service. It supports clinical decision making, and it is in use across many IT healthcare systems and supports patient care.
Our Provider Assurance Pharmaceutical Services team support NHS pharmacy contractors in various services. Some of these include the new medicine service, out-of-pocket expenses, vaccination services and blood pressure checks.
Our team support pharmacy contractors to understand the claims process and keep appropriate records so that they can claim accurately and on time. Last year we supported 8,596 pharmacy contractors with their pharmacy quality scheme declaration.
As well as helping pharmacy contractors directly, we provide assurance to NHS England by carrying out impartial evidence-based reviews. We support ICBs to help them make decisions that drive improvements and behaviour change.
Our NHS Dental Services team manage Compass, a secure online system that allows contractors to manage their contracts, view their superannuation payments and manage their finances correctly. As part of this, we help some ICBs with the Compass authorisation form, enabling them to manage their providers and performer access to Compass with ease and being added to contracts, and make sure we reduce the administrative burden as a result.
Our Provider Assurance Dental team carry out post-payment verification on business rates assurance, as well as undertaking the mid-year and year-end reconciliation. We are also able to assist with contract relocations and contract amendments, as well as orthodontic close-down. We also have a team of highly qualified clinical advisors. They're experienced dental professionals who work with performers, providers and ICB stakeholders. They also support the Provider Assurance Dental team to produce best guidance, as well as assistant dentists with compliance to regulations.
So our clinical expertise sets us apart from different organisations. The other clinical advisors and I have a practice in our respective professions in practices such as opticians, pharmacies, dental and GP surgeries. We oversee decisions about the quality and integrity of the claims and provide and develop supporting materials for both contractors and performers. On top of that, we also provide contract management services for general ophthalmic services contractors. This ensures a standardised process when dealing with their NHS contracts. Through this, we provide ICBs with a live record of the contracts held in their areas.
We also work in collaboration with ICBs to produce the Primary Care Commission and Activity Report. That's a national report that highlights the management of contractual performance, the procurement and expiry of contracts, the availability of services, and the assurance of policy compliance. We also work very closely with contractors on GOS4 pre-authorisations and post-payment verification activity to review and confirm the accuracy of their claims.
We work closely with GPs and dispensing doctors to carry out vaccine and immunisations post-payment verification. We ensure that claims made by practices are accurate and legitimate so that the ICBs can demonstrate that practices in their area are receiving the correct level of reimbursement.
Through reports and guidance, we can also help prescribers and dispensers see the benefits of the electronic prescription service and highlight to ICBs the uptake of electronic repeat dispensing in their area.
Our data services team specialise in producing a range of reports and data that help NHS commissioners manage costs, track trends, inform decision making and support policy.
Our data products include EPAC2 for prescriptions data, Eden for dental data, and EOPS for ophthalmic data.
We produce a wide breadth of standalone statistical and analytical reports to support decision making in policy, and we've significantly expanded the data available on our open data portal, which has led to enhanced user accessibility and utilisation of our data. We support users from all 42 ICBs with their data needs, and we continue to work with stakeholders from across the NHS, including ICBs, to develop new content to support future requirements.
Our scanning services free up valuable space and allow for quicker retrieval of documents. The NHSBSA is one of Europe's specialist scanning operations. We have a proven track record of handling, scanning and retrieving and securely destroying documents to create digital records. We have worked with over 25 different organisations such as arm's length bodies, hospitals, charities, CCGs and GP practices to digitise their paper records.